As school populations become increasingly multilingual and multidialectal, what are some of the common challenges SLPs face when trying to distinguish a language difference from a true language disorder?
Yeah, one of the greatest challenges is determining whether a child's language patterns reflect differences arising from their linguistic community or evidence of an underlying language disorder. Too often, clinicians encounter features of a dialect or multilingual language development that appear different from mainstream American English and are mistakenly interpreted as errors. A major theme throughout my work is that language variation is systematic. Children who speak varieties such as African American English or other regional dialects like Appalachian English or Ozark English, or multiple languages, Spanish English, Vietnamese English, are not speaking randomly. They are following linguistic rules that govern their speech communities. The challenge for clinicians is learning to identify which patterns are expected within a dialect or a language and which patterns are atypical regardless of the child's linguistic background. Another challenge is that many clinicians are trained using assessment frameworks that emphasize comparison to mainstream English norms. And in an increasingly diverse school setting, we need frameworks that help us identify disorder within a dialect rather than treating the dialect itself as evidence of disorder. And as I often tell students, our task is to understand the rules and the patterns of language and dialects, understand how context influences those patterns, and then determine whether there's evidence of an impairment that within that linguistic system. And it's really great that Christy Moblin and Janet Edding at Louisiana State University have developed dialect worksheets to learn about children's linguistic strengths and weaknesses. But such tools are only useful when the clinicians have a basic knowledge of language science.